In the United States, you can open a drug rehabilitation center with no medical training, no licensed therapist required, no proof that your treatment actually works. And in some states, you need less paperwork to open a rehab facility than to open a restaurant. There are around 15,000 addiction treatment facilities operating in America right now. And what you probably don't know is that a significant number of them are owned not by doctors or therapists, but by former addicts with a direct financial incentive to keep beds filled. The practice has a name inside the industry. They call it patient brokering. It's illegal in most states, and it's still happening. So let's go back to where this started. The modern addiction treatment industry wasn't built by medical professionals. It was built by Alcoholics Anonymous. In 1949, a facility called Hazelden opened in Minnesota. It was the first residential treatment center to apply the 12-step model to a structured program, no doctors on staff. The founding philosophy was simple. Addiction was a spiritual problem requiring a spiritual solution. That model. 28 days of residential treatment based on peer support and spiritual principles became the template for the entire American rehab industry. And here's where the money comes in. By the 1980s, insurance companies started covering addiction treatment. That created a financial incentive to expand. Then the opioid crisis hit and created a generation of people who needed help. And where there are desperate people, there is money to be made. Between 2006 and 2016, the number of treatment facilities in the United States doubled. The barrier to entry was, in most states, almost nothing. In 2012, a practice began emerging in South Florida that investigators would later call the Florida Shuffle. And once you understand how it worked, you'll never look at a rehab helpline the same way again. A person struggling with addiction would search online for help and call the helpline they found. What they didn't know is that helpline wasn't operated by a treatment facility. It was operated by a broker. The broker would receive a fee, sometimes several $1,000s, for referring that caller to a specific facility. And that facility wasn't selected because it was the best fit for the patient. It was selected because it paid the highest referral fee. The patient would arrive, go through treatment, and be discharged. Shortly after, they'd relapse, which is statistically common in addiction recovery. And when they relapsed, the same broker network would refer them to another facility. Some patients cycled through this system 4, 5, 6 times. Each admission generated a new insurance claim. Insurance companies were paying on average $1,000 per day for residential treatment. And here's the detail that should make you stop. One facility in Delray Beach, Florida, billed a single patient's insurance $400,000 over 18 months. That patient died of an overdose. But it gets worse, because connected to the treatment facilities was a second layer of the operation: sober living homes. Sober homes are transitional housing for people in recovery. And what you probably don't know is that in Florida, until 2017, anyone could open one with no license, no inspection, and no oversight whatsoever. What investigators eventually found was a network of sober home operators who were being paid to ensure their residents relapsed. Former residents described being offered drugs inside the sober homes. Some described operators who used drugs with residents themselves, because a relapse triggered a new treatment admission, and a new admission generated a new referral fee. A Palm Beach County grand jury investigation in 2018 described the system as one that preyed on the most vulnerable people at the most vulnerable moment of their lives. Between 2015 and 2018, Palm Beach County recorded over 900 overdose deaths. Investigators concluded that a significant number were linked directly to the patient brokering network. Now here's the part that tells you everything about how this was allowed to happen. The Florida Department of Children and Families received complaints about these facilities throughout this entire period. Enforcement actions were rare. And if you're asking yourself why, here's your answer. Addiction treatment was one of Florida's fastest growing industries. It generated an estimated $1 billion annually in Palm Beach County alone. Local officials, landlords, and taxi companies all had financial stakes in the ecosystem. The federal government was aware of the problem. A 2015 report specifically identified patient brokering as a national issue. No federal legislation was passed until 2018. By then, conservative estimates suggested the Florida brokering network alone had generated over $1 billion in fraudulent insurance claims. Several operators were eventually prosecuted. The largest sentence handed down was 27 years. Most received far less. And the practice migrated to other states. But here's what the prosecutions didn't fix. And this is the part most people never hear about. Underneath all the fraud was a more fundamental problem that nobody addressed. There is no established standard of care for addiction treatment in the United States. The 28-day residential model, the one built on AA principles in 1949 with no doctors and no clinical evidence, is still the dominant model today. A 2016 review published in the New England Journal of Medicine found that most addiction treatment in America is not delivered according to evidence-based practices. And here's something that should genuinely anger you. Medication-assisted treatment, the use of drugs like buprenorphine and methadone, which have the strongest clinical evidence for treating opioid addiction, is actively discouraged or outright prohibited in a significant number of treatment facilities. The reason given is philosophical. Many programs rooted in the 12-step tradition consider it substituting one drug for another. The clinical evidence disagrees. Patients who receive medication-assisted treatment are significantly less likely to die. Patients who complete 28-day programs without it have relapse rates of approximately 80%. The industry knows this, and the industry continues anyway. In 2023, approximately 107,000 Americans died of drug overdoses. The addiction treatment industry generated approximately $42 billion in revenue. And if you're thinking those two numbers are connected, you're right. An industry that profits from readmissions has a financial disincentive to cure the people it treats. This isn't a theory. It's a structural reality that federal investigators, state grand juries, and medical researchers have documented in detail. The Florida Shuffle hasn't ended, it's moved. The 28-day model with an 80% relapse rate is still the default. The helplines are still operated by brokers. The sober homes are still largely unregulated. And somewhere tonight, a person who needs help is calling a number they found on Google. They have no idea who's on the other end.